With a foundational grasp of memory, cognitive load theory, active recall, and spaced repetition, let's delve deeper into the intricate realm of memory's information processing model, focusing particularly on encoding. Improving our encoding abilities is paramount. It prolongs the retention of information in our long-term memory, reducing the need for excessive reliance on active recall and spaced repetition. This in turn fosters a profound understanding of the subject matter and ultimately saves time. It prevents the futile endeavor of cramming information into our long-term memory through sheer repetition and the frustration of repeating the same flashcard a million times. Now, to maintain a practical approach without veering into the intricacies of psychology, this video will explore the fundamental principle underpinning effective encoding techniques. Effective encoding can be approached through various methods, as there is no one-size-fits-all approach. However, the one key principle to understand is that thinking occurs in different orders. Bloom's Taxonomy, a framework that delineates various levels of human cognition, posits the existence of lower-order thinking skills and higher-order thinking skills. In simpler terms, higher-order thinking skills transcend mere memorization and rote learning. They empower us to utilize information actively, moving beyond rote memorization. Let's delve into Bloom's taxonomy to illustrate this concept. Bloom's taxonomy. According to this diagram, the hierarchy of thinking progresses from lower order to higher order, with the lower three tiers encompassing the basic thinking skills of remembering, understanding, and applying. Unfortunately, many students tend to linger or become stuck within these lower tiers when engaging in the learning process. You might have heard the adage that memorization does not equate to true learning because genuine comprehension is a prerequisite for considering a topic learned. However, this viewpoint is not entirely accurate either, as understanding alone can still leave knowledge somewhat isolated within the broader context. Efficient encoding hinges on establishing connections with prior knowledge and related information while maintaining a well-organized mental framework. In accordance with Bloom's taxonomy, the higher-order thinking skills of analysis, evaluation, and creation become vital for effectively working with information. It's crucial to acknowledge that the information we study resides in our working memory for only a limited duration. Consequently, it becomes imperative to establish connections with newly acquired information as it enters our working memory. This is one of the reasons why jotting down notes immediately after consuming new material is not particularly effective, as it essentially offloads the information from working memory onto a page or document, alleviating the cognitive load. Surprisingly, when we transcribe information, it can lead to a false sense of assurance that we have comprehended the material or have a firm grasp of it, solely because we've written down notes or sentences. This phenomenon extends to highlighting and rereading text in books or notes as well. The true measure of learning, especially on academic exams, lies in the information that resides in a usable format within our brains. Therefore, when assimilating new information, instead of hastily writing notes, consider spending time reflecting on how this knowledge fits into the larger picture. Pose questions about the information, such as why is it named a certain way, how it impacts other aspects, and whether there are alternative perspectives. Start putting the information together on a mind map. These approaches can effectively set your mental gears in motion in the right direction. Traditionally, many study methods and educational outcomes revolve around the what aspect of knowledge. To enhance the encoding of novel information, it is crucial to shift the focus towards the why aspects, as this facilitates a deeper understanding and retention. This transition brings us to a pivotal ingredient in the learning process: curiosity. The more curiosity we exhibit towards a subject, the more avenues we discover for delving deeper into the material and forging meaningful connections, not only within the subject matter itself, but also in its broader implications. It entails a shift from merely understanding what it is and what it does, to exploring the profound why behind its functioning, dissecting the processes orchestrating specific outcomes, and unraveling the rationale underpinning the provided information. Instead of navigating through abstract concepts, let's use ACE inhibitors as an example. In nursing school, ACE inhibitors are undeniably a medication you will learn. Take captopril, for instance. Initially, you'll learn that it's an antihypertensive medication, and you'll soon recognize that most ACE inhibitors typically end in pril, Diving deeper, you'd learn that ACE stands for angiotensin converting enzyme inhibitors, and their primary role is to manage blood pressure. This foundational knowledge places you at the remembering stage. However, this recall might falter if asked about its application in specific community settings or in relation to individual patient histories. Analyzing further, pulling from anatomy and physiology, we understand that these drugs block angiotensin converting enzymes in the lungs, preventing angiotensin II from causing peripheral vasoconstriction. This in turn lowers aldosterone secretion, impacting sodium and water retention as well as potassium excretion. Reaching this depth of comprehension elevates us to an understanding of captopril. When faced with a practice question about a patient displaying heart failure symptoms, you could identify captopril as a potential prescription. This demonstrates application of knowledge in practical scenarios. Moving along Bloom's taxonomy, how do we ascend to higher cognitive levels? The key is integrating curiosity and context. Visualize a scenario where captopril is prescribed for heart failure and hypertension. Now, after an initial understanding, imagine reviewing a patient's health history and vital signs to determine their medication compatibility. Suppose you notice the patient's significant other voicing concerns about a persistent cough, although the patient downplays it, but you can tell that it's causing problems at home. Such real-life considerations could prompt questions about other medications with similar effects, but with fewer side effects. Your curiosity might lead you to ARBs, which work similar to ACE inhibitors. But unlike ACE inhibitors, which can induce a persistent cough due to bradykinin release, ARBs tend to be better tolerated. Drawing such parallels enables a holistic grasp on the topic. This comprehensive view is invaluable. Sometimes surveying related subjects before delving deeper into a specific one can foster a richer understanding. Learning isn't a straightforward process. Our brains work by connecting new knowledge to existing frameworks. In our scenario, you've assessed the medication, explored alternatives, and weighed the consequences of its continued usage. Now, envision creating an S-bar, situation, background, assessment, and recommendation, to communicate your findings to the primary care provider. Remember, while nurses don't diagnose, they play a pivotal role in patient care. The goal here isn't to infringe upon a physician's domain, but to illustrate comprehensive learning beyond textbook isolation. In this exercise, we've analyzed the effects of captopril, evaluated its pros and cons in relation to other medications, and created a potential communication strategy for better patient care. Creating similar scenarios or even quizzing peers can be an engaging way to grasp the material from different angles. Another approach could be using relational flashcards, like those in Anki, to test knowledge based on relational concepts. In conclusion, our journey through memory, cognitive load, and the intricacy of encoding emphasizes the importance of moving beyond mere memorization. The true essence of learning lies in forging connections, eliciting curiosity, and applying our understanding to real-world scenarios. Captopril, as discussed, serves as a testament to how a single topic can be explored from multiple dimensions when anchored in a broader context. As we continue our academic and professional pursuits, let's champion the art of deep learning, being ever curious, and always willing to challenge the boundaries of our understanding. Embrace the depth, enrich the mind, and always remember that the realms of knowledge are vast and interconnected, awaiting our exploration.